Our agenda for today. Great, thanks, Kate. Our agenda for today is we welcome Sylvia Castro with the Canadian Red Cross, who is going to do a presentation on the Friendly Calls program. We'll go through a few resources and FYIs for you, and just a note at the start here that our next meeting will be February 27th, where we will be welcoming a presentation around household and food insecurity, which is something that we have been hearing from community partners as something that they're experiencing in higher frequency. So we'll look forward to that in February. And without further ado, I will pass the screen sharing baton over to Sylvia, and I'll stop sharing. Welcome, Sylvia.
Thank you very much. Good morning, everyone. My name is Sylvia Castro. I'm the provincial coordinator for the Friendly Calls program in Alberta and Northwest Territories for the Canadian Red Cross. I started working for this position almost 3 years ago, and I'm really excited to be in here. Thank you so much for your time. And I'm going to start by sharing my screen. Hopefully, everything is gonna go smoothly there.
Great.
Okay, perfect. Awesome. So, I think, sorry about that, there. Okay, so for the Canadian Red Cross, it is really important to help people and communities in Canada and around the world, really, in times of need and support by strengthening their resilience. We also believe in the power of human connection, reducing stress, decreasing anxiety, and improving people's well-being. I think it's really important to notice the fact that we are engaged in communities' well-being, amongst all other things that we also do at the Canadian Red Cross. So how did the program start in Alberta? In response to the reports of feeling of isolation from our health equipment loan program, so our health equipment loan program is a program where we loan medical equipment for a short term for people undergoing surgery or having an injury, but the main thing is that they want to recover at home. So we started noticing people talking about how they were feeling regarding isolation and loneliness, and they were feeling disconnected from their community. So that's how we launched our Friendly Calls program in July 2020. Part of the objectives are to help reduce feelings of isolation and loneliness in adults through scheduled telephone calls with trained Canadian Red Cross volunteers, and also to promote resilience and well-being in participants by providing companionship, emotional support, coping techniques, and connections to community resources as required. So what started as a check-in call became much larger, in the sense that people needed more than just that wellness check-in. They needed to have more connections, more resources. Sometimes it wasn't only about the medical equipment, it was about how they were feeling regarding all the situation especially during the pandemic. Although that continued after everything was back to normal, and I quote that because I don't know if things were back to the way they were. But it was really important for us to provide that support. We always say it is not just about making a phone call, it's about forming connections. And the Friendly Calls program in Alberta was really important because there were studies talking about the risks of social isolation. So, for example, that translates into poor mental and physical health, cognitive decline, increased risk of depression, weakened immune system, increased risk of premature death, poor sleep quality, and addictions. So it's not a simple problem. It is something that embraces a lot of things. And the good thing about the program is that we try to cover different aspects of it. For example, if they do need resources regarding food or affordable housing, or maybe they had questions about COVID, or maybe they needed legal advice. All of that, we work with community resource manual that helps us out with providing those phone numbers. So it is really important for us. So the Friendly Calls program is a free to access phone-based program that is available to adults who are experiencing isolation, loneliness, or anyone who feels they could benefit from more social connection. So this program is open to anyone who is 18 and older. Anyone who feels that they can benefit from this, it's more than welcome to join us. And the program is designed to link volunteers with individuals who would like to engage with others and to provide a connection to community resources. The benefits of the Friendly Calls, like we talked a little bit before, is it helps reduce the feelings of isolation and loneliness. They create an opportunity to form social connections and to check on the participants' well-being. In addition, these calls promote resilience and well-being in participants by providing companionship, emotional support, coping techniques, and connection to communities' resources as required. We have also noticed that these phone calls are not only beneficial to the participant, but they're also beneficial to the volunteer. We are happy to see that it's a two-way street where both of them have taken something out of this scheduled weekly phone call. So no matter where people live in Canada, the Friendly Calls program is open to anyone over the age of 18. We have launched nationwide in May 2023. So we have a 1-800 number that is available to anyone in Canada. And here in Alberta, we also provide our local numbers in case they would like to talk to us directly. So some signs of social isolation are be homebound and living alone, living in remote locations. This is very, very important to notice that we would like to reach out those remote locations, and we want this program to be available to anyone who may need it. Another sign is a physical and or mental illness, and also have minimum to no interaction with family or friends and no access to transportation. We noticed that this isolation was going more, it was more than just, you know what, I don't have anyone to talk to. It was also a geographic problem where they didn't have sometimes contact with their family members, or they didn't have any friends. And like it says right here, no access to transportation, that was a really big one. So that makes them stay home, and instead of trying to be part of community events or maybe activities where they can talk to other people. So I talked about this. So the process is a little bit complex, I would say. So the way it works is, first, we have a centralized intake with Friendly Calls advisors. So this could be done by the toll-free number, by calling the toll-free number, or maybe filling out an online form that it's on our webpage, or maybe they can fax it. And then after we have that, all that information, we have a responsive intake where the Friendly Calls coordinator or the advisor would be making we'll try to know if this is the right fit for the person who is calling. And if it is the right fit, then we welcome the participant and we start the matching process with a Friendly Call volunteer or staff. It is really important for us not to leave anyone behind, just because sometimes, you know, we have a lot of people interested in the program and maybe we don't have enough volunteers. So we do have staff making those phone calls. We don't want anyone to be waiting for that phone call. So we are always on top of it, in the sense that if we try to match them, we try to match them within a week. But that's like saying a lot. Sometimes we just try to do it 1 or 2 days after the phone call, because we have to remember that they are asking for that phone call. So they're asking for that help. So we don't want to keep them waiting. And then we do those friendly calls or checking calls every week, or sometimes we do have bi-weekly phone calls as well, depending on what the participant would need. But during the intake form, we will ask those questions. So they will let us know if they are interested in a weekly, bi-weekly, or sometimes even a monthly phone call. Sometimes people just want to have that human connection. So they just want to say, hi, how are you? And things like that. So we also follow up with the advisors regarding the participant needs. So we review everything. We just want to make sure that they are getting what they're needing. And if there is any situation where people need more than the friendly call from a volunteer, we do have advisors and mental health specialists that can jump in and do those phone calls for us. So we do have process for escalations, and we have all of that covered. So how does the pairing work? Prior to the first call, participants must give consent to be contacted and must know what to expect from the Friendly Calls program. So we do a first phone call where we welcome them, we explain to them, and we introduce the program to the potential participant. We talk during the intake about their interest, their medical condition, and we also collect contact numbers in case of an emergency. So then we have a trained Friendly Calls volunteer who is matched with the participant. And the way we do that is we try to match them with comparable interest. So that's why it is really important for us to get to know the participant as well as the volunteer. We have a very close relationship with them. So it's not I would say it's a pretty easy process in the sense that once you get to know your volunteers and you know what the participant needs, then it's easy to do the pairing. So then the volunteer and the participant will decide together on the best time and day to call. The frequency and duration of the calls are determined based on the participant's need and the availability of the volunteer. So sometimes we have phone calls that are 10 minutes long, but we can also have an hour-long conversation. So it really depends on what the participant needs and on what the volunteer can provide. But normally, volunteers are willing to provide with as much time as needed. So after each call, the volunteer completes a tracker that we have created, and this tracker will inform the coordinator of any red flags. Also, we will know the next call and important comments regarding any concerns or issues found. Volunteers have a really long training where they learn how to read those red flags and how to intervene. They also learn about when it's time to make a 911 phone call, when it's time to escalate, and things like that. So they would know not to go outside their scope. Also, it is really important communication. We have our volunteers contacting us anytime they have any concern or any issue, or they see a red flag for the participant safety. So it's communication here is key, I would say. So the benefits of volunteering is you give your time to a meaningful cause, helps reduce social isolation and loneliness. Like I mentioned before, it works both ways because not only the participant gets something from the volunteer, but the volunteer also gets something out of this conversation. They learn new skills and gain experience, increase self-confidence. They make new friends and stronger friendships. So this is really, really great to see that as time goes by, those relationships become stronger. They also strengthen their community and establish a sense of belonging. So I have a quote here from one of our volunteers. He says, volunteering for the Friendly Calls program gave me a better understanding of life. I look at things from a new perspective. Making friends calls has helped me develop a different outlook to see the community, giving me a sense of belonging. I am honored to be part of such a great organization and the Friendly Calls program. I would love to do more. So this is very important for us to notice that it is a gain-gain situation. Both parts get something out of the Friendly Calls. We have different volunteers from different backgrounds. We have volunteers, for example, Tamara, she is a nurse, and I don't know how she still manages to volunteer, but she always gets the time to make those phone calls. And she's been volunteering for a couple of years now, and she feels very, very connected to the people, and that's why she keeps on coming back and volunteering her time. And we have Harrison. He is actually in BC, but he still volunteers for us, even though he has he's currently in a healthcare related degree program in BC. And same as Tamara, he always finds the time to do the Friendly Calls. Well, like I was mentioning, we just like to say it's not just about making a phone call, it's about forming connections. So we have some quotes from participants. For participant 1, thank you, Red Cross, for this program. Without you, I don't know what I would have done. Participant 2, I was expecting your call today. I have many things to tell you. Participant 3, it's nice to know someone cares about me. Participant 4, it was nice to talk to you. I appreciate your call and great service. And participant 5, your calls make me feel happy and safe. And this is something that we are looking forward to. All the great feedback that we have receiving from our participants and volunteers let us know that this is a program that it's giving back to community, and it's helping people to face their loneliness and their isolation as well. So as the program grows, we're seeking new volunteers and hoping to reach more people who could benefit from the Friendly Calls. We are also planning an outreach. We're also planning to do outreach to rural communities. And we also would love to develop new partnerships to combine resources and expertise to create a greater impact. We have some program promotions where we can mail them, and it's we have the printable version, or we can also print it out for you in case you would like to post it. We have also in-person Friendly Calls presentation. We try to participate in community events, and we share our success stories. I think it's important to know that even though the program is fairly new, we have found a lot of success stories where people are feeling better, are feeling less lonely, are feeling more connected to their communities, and loneliness is something that they have better tools to face. So this is part of our promo material. So as you can read, everyone deserves to benefit from the power of human connection, no matter where you live in Canada. And you can see the 1833 number. So that number, it's a toll-free number that you can call anywhere in Canada. And like I mentioned in the beginning, this is open to anyone who is 18 and older, and who you can also tell people that might benefit from the program and do the intake on their behalf. So you can work, you can help this program by letting people know about it, and so they can call us, and then we will do the intake, and we will go over all all the intake forms and all the process to pairing until we get a volunteer who is going to be making those friendly phone calls. For some people, a little conversation can make a big difference. And it's amazing how we get feedback regarding participants saying that it is the highlight of their day, that they're waiting. Sometimes the phone call is in the afternoon, so they're waiting all day for that phone call, which is why it is important for us to have that relationship with them where we know that that phone call is going to be made every week, the day and the time that have been set prior with the volunteer. And then if for some reason the volunteer cannot make it, we always have someone to call on their behalf. So that phone call is going to be made no matter what. We try to not to leave anyone behind. And so this is another promo material. So the Friendly Calls program is safe, accessible, and free. Make a connection one call at a time. So we invite both volunteers and participants to join the program. We do have additional resources in case this is not the right fit, so we will help them along the way. But most of the time, if what you are looking for is for a friendly chat or someone to check up on you and make sure that you're doing okay, then this is, I think, the right program for you. Volunteers are more than happy to talk to you and to make sure that all the needs are being met, even if it's with just providing a phone call or maybe a phone number or a connection with community events or things like that. When we nurture connection, we reduce stress, decrease anxiety, increase our vitality and our overall well-being. Sometimes a little conversation can make a big difference. The Friendly Calls program matches people over 18 years old with trained Red Cross personnel who connect with them regularly over the phone to check in, provide emotional support, encourage healthy coping strategies, and suggest well-being resources and community connections to other existing services. So it's more than just a phone call, it's about forming connections. And to participate, you deserve to benefit from the power of human connection, no matter where you live in Canada. Connect with us. And to volunteer, it's easy to become a Friendly Calls volunteer. All you need to bring is your kindness, compassion, and a few hours weekly. And this is really important to notice as well. If you would like to volunteer with us, we just ask for a couple of hours a week. Sometimes it's not even that, because like I mentioned before, it really depends on how the conversation it goes. Sometimes they have a lot to talk to you about, and some other times they just want to say, thank you for checking up on me, and that's the end of the conversation. So it really depends on how everything goes. But we do ask for a couple of hours a week. Sometimes we do have volunteers who would like to call more than one participant, so we do that as well. It really comes down to their availability and their willingness to help as well. So I have here our toll-free number, the 1-833 number. I also have put the email address in case they don't want to call them and they just want to get a referral from us. And I also put our local phone number. So the first 403-585-4173, it's for Calgary. And the 780-702-4157 is for Edmonton, although you can call from anywhere. And even, like I said, from rural areas, we would like to reach out everyone who needs anything from this service. And thank you so much. I would be more than happy to answer any questions if there are any.
That's fabulous. Thanks so much, Sylvia. There are some comments in the chat box. Some are already emailing relatives, telling them about the opportunity to volunteer for a program. So that's fantastic. And then Sharon Anderson with some comments there around the importance of that connection and within it. So, you know, it's so key to have resources like this. So there is a question from Pam about the screening process for volunteers.
Oh, that's a great question. So we do, their background is not really important. They can, like I mentioned during the presentation, we have volunteers who are we have this volunteer who is a nurse. We have volunteers like going to school and all of that. So for the screening, we do the screening for vulnerable people. We also go to, we do what we call a discovery call, which is a call where questions are being asked and we make sure that this is the right fit for the volunteer. We also do an orientation where we go over everything that is needed from them. Of course, we talk about confidentiality, having a secure place where to make those phone calls, keeping all that information secure, and they also have to go to an extensive training um, where they get all the tools needed in case something arises. So for example, if there is a red flag or something like that. And we have ongoing training as well. So if anything changes or things, or we have new courses or things like that that they can go over. So the main thing is also for volunteers to be over 18 years and over 18 years, sorry. And the basic screening, it's done in the beginning. So if um, that is not successful, then they don't go to the next stages.
Okay, yeah, thank you. Just an additional question there around training for the volunteers and screening process. So that's great. And then another one around if the training is done virtually for volunteers.
It's we have both options. Most of them they choose to do it virtually, and I think it's fair to understand that commute, weather, and all of that. So, but if they do want to come to the office, we also provide it in person. So it's really up to their needs and how they would like to proceed. Um, we, I think for us to have a better grasp of who the person is, we prefer to do it in person, but we do understand that a lot of things happen and that nowadays everything is virtual, right? So we do that as well. So we're very, very flexible in that sense.
Yeah, that's great. I think, especially for those more rural communities, right? It may not be, may not have the access to those bigger offices. So there's a multi-layered question here from Shauna, who's just had to jump off, but the questions are around, can discharge staff refer patients to this program? So for those being discharged from the hospital, so will 211 send people to this opportunity? And the last one is, where are the majority of calls coming from, if you have any data around that?
Absolutely. So we try to work with discharged people. So we do have a form that can be faxed to us, and that's how we get in touch with them and do the intake form. For the 211, I think they were working on it because I think you have to fill out a form with all the information and that. So I think they were working on it. And then for we have people from all over the place, and we are really happy about that. We have, I would say that 30% of our participants are from rural communities, and the rest are more from bigger cities. But we do have, like, when it comes to ages, we have young people as well as middle age and seniors. So we have a little bit of everything. It's not just, it's interesting to notice that it's not focused on just one age bracket. It's more than, um, we do have young people needing that social connection. We do have seniors, and we have a little bit of everything, different backgrounds as well. That's something really great about the fact that we live in Canada and a lot of people have a second language. So sometimes we are able to provide that service in their language instead of English. I think it's really, um, it's a great opportunity for a lot of people. Yeah.
Yeah, excellent. Thank you.
You're welcome.
So a question around age group. So that's great. And how wonderful that there is that spread of people who are accessing it from younger ages as well. We are becoming more and more aware of that need for connection. A question from Jen around what's the best way to get collateral to share with Memory Cafe attendees in Okotoks and Black Diamond. It makes me think of the posters that you shared, Sylvia, if there's electronic copies that we could pass out to the partners group.
Absolutely. We do have, I can send out that information. I can print it out myself as well and provide it to you. So we do have all our promo material that it's intended for to talk about all the information regarding the Friendly Calls program. So I think that would be a really good idea. Like I said, there is a lot of work that still needs to be done. It's a fairly new program, and it's like the success has been so overwhelming that sometimes it's really hard for us to manage all the different aspects. But that's for sure. Like if you would like me to send out that promo material, I would be more than happy to do so.
Sure. So we can maybe if you want to send us the posters when Kate sends out the recording and the slide deck, she can attach those posters. But Jen, I'm wondering if you're wanting to connect directly with Sylvia, and I think within the slide deck, your contact information is there as well, so folks can reach out directly to you.
Absolutely, yeah, I would be more than happy to answer any questions that you have.
Great. Some other comments. This is an amazing program. I believe the seniors clients at CIWA can benefit from this support. A question around wondering how to connect with you, so that information will come out when the recording comes. And then just another comment around what a great program. Social connection is so important, especially for those who are very isolated. We'll spread the word. Sharon Cornelius, I see you're just adding in a question there, but it looks like maybe you hit enter too soon. So feel free to come off of mute as well if you would like to just speak to it. Okay, does the volunteer training program include connecting with individuals with dementia?
Oh, that's a really great question. Actually, the training itself does not have that, but we do have additional trainings about that. So what we do is every 3 months, we have like conference for all our volunteers where we touch topics like dementia and things like that. So they do get more information about it, but we do not have specifics about dementia.
But there are some additional programs, I guess they could take.
Yeah, absolutely.
Okay.
That's the good thing about we have a platform where we have a lot of courses that are open to all volunteers. So when it is, like I was saying during the presentation, if it's out of their scope, most likely they're going to talk to us, and we're going to connect the participant to an advisor or a mental health specialist, so we know that we are the right person is actually doing the right thing too, right?
Yeah, for sure. Okay. The number of comments here, Sylvia, just about the excellent presentation, excellent and heartfelt presentation, and gratitude for all you're doing to reduce social isolation and loneliness. Very timely and meaningful. Yeah. Any additional questions or comments from the group?
I guess I was just thinking you had talked about your engagement with rural communities, and I think there's a real opportunity right here on the line with the number of people who are from rural communities, and wondering should they reach out to you, or how can we kind of facilitate that to support your engagement?
Oh, that would be awesome. So yeah, they can connect with me. Like I always try to read my emails within the hour I received them, so I don't let anyone waiting. Yes, please. Yeah, they can connect with me.
Okay, great. Thanks, Sylvia.
You're welcome.
I'm just thinking of comments that we've heard from the community partners that we work with, Sylvia, not only the benefits of this for individuals who are experiencing loneliness, but you talked in the beginning about the value for volunteers. And, you know, having that flexibility to be able to provide that online support, I think that would meet the need of what we've heard from some of the communities as well, who have volunteers looking for some unique kind of opportunities to contribute.
Yeah, absolutely.
I
That's
just wanna-
really important to know that it is like I said, a win-win situation, because it's not
Yeah.
only for the participant, but it's also for the volunteer. We have great feedback from both sides, and I always feel so good about the fact that when they volunteer their time, they can also pick and choose their date and the time where they're going to be making those phone calls. So it's not said that, oh, it has to be between 8 and 4. They can do it even on a Saturday if they don't have the time during weekdays.
Yeah, yeah, fantastic. I just see Jen's hand up there. Go ahead, Jen.
Yeah, I just had a follow-up question to Sharon's. You mentioned, Sylvia, about the in-person presentations, and I'm just wondering if that can be done in the rural communities, like specifically for me, it's Okotoks, Black Diamond, Longview, like out that side of Calgary. Is it something that you can do presentations in person and potentially partner for a seniors week type of presentation to a community?
Absolutely, that is something that it's in discussion right now. We know that it's really hard to get that information out, especially to rural communities. So we are willing to do those presentations in person, so we can connect if you would like, and we can set a plan and just go from there. Absolutely, yes, yeah.
Great, thanks, Jen. Ellen, the presentation started to send referrals to home care clients, so glad to have that service. And then a couple of questions around your contact information. So there's a question from Lisa around, have you made any connections with the primary care networks?
No, not yet. We were so what we did in the beginning was that all the people we were calling were from the health equipment loan program, and that's how we would get our participants. And then when we launched nationwide, um, it's been a little bit hard because I think people um, are not getting the information. So we try to do that outreach, and it's a big plan that we have, but we haven't been able to do it just yet. So we haven't been able to connect with primary care, unfortunately.
Well, maybe the promotional materials that we can send out with this, the people on the line can share that within their networks and help with that.
Absolutely.
Yeah,
Mhm.
for sure. Excellent. Any other final questions or comments for Sylvia?
I was just going to say that it's so wonderful to hear about something that's happening right now that we can have an impact in right now. And that's so I really appreciate that, Sylvia, that you've been able to bring that to us.
Thank you so much for your time. I really appreciate your attention. So thank you so much. And like I said, I would be more than happy to connect with anyone who would need additional information. And yeah, we will share all the promo material and my email address.
Awesome. Excellent. Well, thank you. Thank you
you.
so much, Sylvia. Okay, so let me just see if I can share my screen here for the last couple of slides.
Thank you.
All right, I'll just look for a thumbs up that you can see my screen. Okay.
There you go.
All right. So 3 resources that we wanted to bring to your attention today. One is from
TED
TED
Talk.
Talk. I was going to say YouTube, but I knew that wasn't the right one.
Oh, I wonder if Sharon. Okay, I think Sharon screen froze there. So I will just get ready to share this. There we
Did
go.
I disappear?
You did, but you're
Yes.
back. So that's
I got a prompt saying Zoom quit unexpectedly.
okay.
So,
Do you want me to share my screen, Sharon, and then you speak to it?
If you've got it up, Helen, sure.
Yeah, I just
Yeah.
was getting it up there to.
Okay.
Yeah.
So just while you're doing that, I'll talk about that. So it's called Resilience in Turbulent Times. The answer is community. So there's a link within the slide there for folks to access that. And the second one is actually, Helen, maybe I'll let you speak to this one because it was one that you brought forward. So go ahead.
Yeah, sure. So it's a introductory course around implementing change, and it talks about kind of high level concepts, things that might be facilitators or barriers to that. But it's a free course. It's about an hour and a half long, and I just thought it kind of goes over some of the language that people use in this area that helps to clarify some of those concepts.
Great. Thanks, Helen.
Mm-hmm.
And then the third one is just to flag an opportunity through the Rural Development Network. They have a call for proposals out now called Reaching Home, which is for funds in rural, remote, First Nation and Métis settlement communities and organizations in Alberta. And it's really around addressing and responding to homelessness. So again, this is a topic that we have heard come up from a number of communities that we're working with. So just passing that along as a FYI for folks, and do have a little bit of time for the deadline, although January seems to be clipping away quite quickly. February 9th is the deadline for submission for that. So this will all come out as well in the materials when Kate sends them with the recording. And just a reminder around our webpage, anything that is pertinent or new within the project. Just noticing here now, we do have in our featured well, we should update our picture, I guess. We do have our social return on investment report that's up there. So the featured well rotates to some new material in there, and then again, the playlist of all of the partners meetings and recordings is all available on the Healthy Aging Alberta YouTube channel. So feel free to watch past sessions of the partners meeting there. And of course, join us if you haven't already on the Healthy Aging Core Alberta website. All right. Well, that draws us to a close and things that we had planned for this morning. Any final comments or questions from folks? Well, we drew a larger than normal crowd this morning, so thank you all for taking time out of your busy mornings and your busy week to join in. And again, Sylvia, thank you so much for sharing information about the Friendly Calls program. I expect you'll be hearing from a few people on the call today. So thanks again, and have a great week, everyone. Enjoy this warmer weather. Okay, bye-bye.